Hi friends, welcome to Charcos. I'm Dr. Seema Balian, the founder and director of Charcos. Charcos is a healthcare recruitment and training company with over 15 years of experience in providing turnkey solution for training and recruitment needs for the nurses, doctors, and AHPs such as radiographers, occupational therapists, ODPs, and many more. OSCE training for all fields of nursing such as adult nursing, mental health nursing, pediatric nurses, midwifery, and learning disabilities. OSCE training is available in India as well as in UK. Orientation for life in UK, OSCE exam bookings and the logistics bookings, excellent pastoral care. Our state-of-the-art learning platform includes reading materials, videos, quiz to enhance your learning and equip you for a positive and a better outcome. For more information, please visit our website www.charcosglobal.com. Our Facebook page, Instagram, and LinkedIn pages by the name of Charcos Global, and subscribe our YouTube channel. Press the bell icon for regular updates and all the information that you require. We are looking forward to seeing you on our site and being a partner in your enhanced journey. Thank you very much.
This is Dr. Seema Balian. So today we are going to be looking at introducing evidence-based practice and also going through some of the principles of the evidence-based practice and how to handle the scenarios which are coming on the evidence-based practice. Now, as you all would understand and already know, that this is one of the new topics which have been introduced as a part of the new OSCE. So there is a lot of apprehensions between people that how we are going to handle, what will it entail, how we are going to be attempting this. But believe me, this is a fairly simple and easy topic. All you have to do is to understand the principles behind what is meant by evidence-based practice and how you can use it. I'm sure that all of you in one way or the other are already using evidence-based practice in your day-to-day professional life. But sometimes when we are asked to actually write about it, or when we are asked formally to analyze something, then that puts us in the position of being anxious and being a bit nervous. So let's hope that after this video, you have a better understanding of evidence-based practice and you are able to handle the scenario. Okay, so let's go. So a little bit about the station. Evidence-based practice station, it is a silent station. The time that you are given is 10 minutes, and you will need to complete one scenario of evidence-based practice in this station. We'll need to use the black pen to complete this station. Make sure your writing is clear and legible and that you complete all aspects of the scenario. Please do not rewrite or overwrite or cross out if possible. A single cross with your initial on the top is acceptable. Now, please excuse that in this slide, there is a small mistake of PV. It should be evidence-based practice. Now, evidence-based practice, you are going to be getting there are actually 5 scenarios, out of which you will get one scenario which you will have to. And the scenarios are, again, those are the very, very common scenarios which you are likely to see in your day-to-day practice. So the scenarios are diabetes, female myocardial infarction, pressure ulcer prevention, smoking cessation, and use of honey dressing for venous leg ulcers. Now, let's go through the marking criteria. The marking criteria, although they are slightly geared towards the scenario which you are having, but the general principle of all of the marking criteria remains the same. They have the same ethos. In order to answer this station correctly, you will need to understand the principles behind each scenario, as I had already mentioned. And to understand the principle, please go through the reading material and the quiz on the Aryavrat portal. So you will see that there is a reading material on every topic, and there is a quiz with regards to all of the topic that is going to help you prepare better as a background knowledge for that particular subject. A booklet with the marking criteria will be shared with you at the time of face-to-face training. So which is again going to be a more of a help and prompt you to understand it better and to be able to attempt this scenario in a much confident way. Now, this seems to be a busy slide, but I wanted to take you through an example. And please do not get alarmed that the example is not from the 5 topics which are there. So this is a deliberate reason that why we have not taken that from one of the topics, because again, it is to show you and to make you understand the principles which are there behind how to attempt the evidence-based scenarios, and not to sort of give you a scenario answer or a sample answer or something of that sort. So let us go through this example. Now, this example is there in the mock OSCE, which the NMC has provided as well. So you can have a look at it over there as well. So in the example, we are looking at sleep in the intensive care unit. Now, the scenario says that, so in this section, sorry about this, but in this section, you will have a few lines of the scenario. And then there is also going to be an article, and the article is the one which is going to give you the evidence that about that particular scenario which you are going to be attempting. So the article can be as a summary of a research, it can be an abstract, it can be a conclusion. So it is going to be something from a journal which is giving an evidence. So if we read this scenario, it says that you have been working in an ICU for the past 6 months. Most of your patients are given medication to induce coma while they are receiving care and treatment. As patients improve and are weaned off the sedation, you notice that it is common for patients to report that they have not slept for the whole time that they have been in the unit. The patients you are looking after today is Mrs. Green. She reports the same lack of sleep, and she asks that if this is common, if so, why it might be. So now I think that you will understand, and I'm sure that at some point you would have been in this situation when the patient would have asked you similar question. Now, when we get asked these type of questions, we always refer to that why in the answer, we try and refer to some kind of an example or some kind of an evidence to reassure the patient that it is not uncommon for these things to happen, or that it is something that they will usually come across, or it is an expected finding. And what is the recommendation with regards to that? Now, if we read an article summary, the article summary is saying that a systematic review in a well-regarded peer-reviewed journal, intensive care unit. The review found that, and now you will have the findings. So there were few studies which were done. There was a study A, which was a large-scale study. It showed that 60% of the patient discharged from ICU reported sleep disorders and deprivation. Study B, it was a smaller study, but it found the similar results, with 51% of the patient experiencing dreams and nightmares, and 14% reporting nightmares negatively impacting the quality of life, even 6 months after the discharge from ICU. The study recommended that the patient return for a follow-up support appointment 2 or 3 months after leaving the ICU. Study C is a quantitative study. It concluded that the inability to obtain physiological sleep depends on the patient's illness, previous sleep experiences, and the varying severity of their illness. Now, patients in study C reported a number of sleep disturbance factors impacting their sleep, including noise, light, pain, anxiety, nursing intervention, diagnostic test, medication, and non-invasive ventilation. So the review concluded that the sleep disorder in ICU were common, and that there were multiple influencing factors causing sleep deprivation. So I think that all of you would agree with me that when you are looking at this article, you get a very fair idea that, okay, as what is written in the conclusion, that yes, it is a very common thing for patients to have sleeping problems once they are discharged from ICU, but the reasons can be multiple. There is no one reason for that, and there are multiple reasons, and hence it is something which is an ongoing thing and which takes a little while for it to get sorted out. So once you have this evidence with you, it becomes so much more easier for you to explain it to Mrs. Green, because you can now say with evidence and with facts that yes, it is something which we see quite commonly and which is expected, and reassure the patient. So you will be given something like that, and then you have to identify the main points from the summary, and you need to apply the findings to the scenario below. This is a silent and written station, so please write clearly and legibly, and you'll have 10 minutes to complete the station. So this is exactly how you are going to get in the exam. So there is going to be a scenario, there is going to be an article summary, and these instructions which are going to be there. Now, after this slide, I would want to go through the criteria, which is actually going to be the criteria for the marking criteria for this particular scenario. So the marking criteria, you will have to summarize the main finding from the article summary and draw conclusion you will have to draw conclusion, making a recommendation for the practice. You will have to write clearly and legibly. You inform Mrs. Green that it is very common for the patients to experience sleep deprivation in ICU. You explain that the disturbance in sleep may continue for several months after discharge. As you know, that patients, they can experience it till after 6 months. You explain that the nature of the patient's illness, previous sleep experience, and severity of the illness may influence their sleep pattern. So we have already seen that there are various reasons. You inform Mrs. Green that noise, light, pain, anxiety, nursing intervention, diagnostic test, medication, and non-invasive ventilation may have impacted her sleep. You discuss with Mrs. Green any feeling of pain or anxiety that may have impacted her sleep. You invite Mrs. Green back in 2 to 3 months' time for a follow-up support. Now, as you will notice that when we are going through the marking criteria, the marking criteria almost mirrors our finding. So the marking criteria wants us to acknowledge and explain every point that is there in the research. So if I were to give one suggestion, I would say that if you are going through the marking criteria a few times while you are preparing for the evidence-based practice, you will have a very fair idea of what is expected of you to write in that scenario. So please make sure that you read the marking criteria over and over again as a preparation for your exam. So the next slide we are going to be taking as an example for an evidence-based practice. So I have just written an answer for this scenario, and we are going to go through this answer to make sure that I'm able to show you that how it is going to be, how is it going to be like. So please carry on with me. So in this one, this is how the sheet is going to be there, that you are going to get a page, an A4 sheet, which will have your candidate name. And then you will have to write down that what is the relevance of the findings of this research for your patient, and what advice would you give to the patient. And you have to write it in the bullet points. So we have already read the scenario. We know what the criteria is. So I'm just going to read out, and hopefully you will understand that it is going according to the criteria, that the answer that we are writing. So I will acknowledge the concerns of Mrs. Green and take a brief history regarding her current pattern and amount of the sleep. Since it is common of sleep disturbance in patients who have been in ICU, I will discuss the evidence and the finding with Mrs. Green. The recent evidence of 3 studies done suggests that sleep disturbance post ICU admissions were common, but there were many factors influencing it. So the factors could be relating to the patient's condition before ICU admission, during, and also the current circumstances, and they can be sleep hygiene, physical and psychological in nature. My advice to the patient will be to identify the reasons for her sleep problem, and that she should try and maintain a sleep routine and avoid napping or sleeping in daytime. She should also try to cut down on the noise in the room and should be dark and temperature should be appropriate, and she should also try to cut down the activity before sleep and try to relax. She could see her GP in the event of failure of her efforts and see if any intervention is required. And she can be invited back in 2 to 3 months' time for a follow-up appointment. So in this way, we are able to discuss with Mrs. Green and explain the findings of using the evidence base to alleviate her anxiety or about the sleep deprivation after her ICU admission. And we can explain the management, and we can also expect that with all these interventions that we are going to do, that she is going to have a better outcome. So I hope that it might be more clear, and you will be able to understand it better, that with the help of the example, that how we can handle this scenario, and what do we need to be writing, and how we are going to be approaching this scenario. So yeah, that's it about the evidence-based practice. Now, I know that there are various topics which you can practice upon. So please do read a few journal articles with regards to the topics that we had given, the 5 topics. So if you read a few of the journal articles and then try and summarize the findings of those articles, and using the criteria that we have gone through it, so that is going to be very helpful for you to be more prepared for this station. So thank you very much for listening, and I hope that this video has been helpful, and that you are going to gain much out of it. So thank you very much, and good luck.